All right, team, we're always here to bring you the latest. And this one's a tough one for me to swallow because we've been talking a lot about legislating from within federal organizations and entities. So, Health and Human Services, NIH, CDC, coming up with all these additional rules and things that might be outside of their scope. And we've recently seen that in Texas, with the FTC coming out with these non-compete uh, changes, and now the federal court system is saying, wait, that's not within your charge. You don't actually have scope to overturn those things. So we're starting to see some change now that some of the Supreme Court decisions have been made. So I don't know if that's why the fury of these organizations is sort of picked up to try to get more of these things out quickly, because as more of these cases get settled, it will become more difficult for HHS, NIH, CDC, et cetera, to come out with new regulatory language. But so they're working pretty hard on your behalf. And the latest one coming out of the Health and Human Services, we'd heard about this back in May. It was a pretty dense new federal rule on non-discrimination in healthcare. This applies to the LGBTQ community. It applies to those with limited English proficiency, those with disabilities, and other niche areas within that. The comprehensiveness of this ruling now provides a lot of guidance to medical providers and what they now have to do on behalf of those patients who show up at their office. For instance, you are required to provide interpretation for your forms and for your exams, et cetera, at your own expense, for those patients who are deaf or speak a different language from your own native language. If you're not comfortable speaking in a foreign language, or you don't have support staff that can interpret for you, or the patient doesn't bring an interpreter with them, you must be able to provide support for that at your own expense. It's just one of those little things. If you have equipment such as your dental chair that can't be accessed by certain folks with disabilities, it will be your requirement to modify your operatories, modify your chairs, et cetera, to make sure that they are accessible. If you have telehealth and you're offering that benefit, you also have to have interpretive capability there as well, meaning you have to offer your services in a variety of languages, et cetera. So it's really pretty far reaching, I think, what this could look like. I don't have a lot of clarity yet on whether or not this will be most enforced on individuals who are enrolled in Medicare, Medicaid, and state plans. If you are providers for those particular federal agencies or federal insurance providers, then for sure these rules are going to apply to you and you will have to comply. How far that will reach out into the private sector if you are not participating in Medicaid and Medicare is not clear yet. But as we've seen with many other regulatory languages that come out, being in network for Medicare and Medicaid does not impact whether or not those rules apply to you. So it's important for you to know, because you may have patients that start appointing to your office that will demand these types of services and support. And I don't think any dentist wants to deny care to anybody and not be able to help. It's just generally not in our nature and not why we pursue the profession. I think the concern always is to what expense and to what level do you have to be able to provide support for, any nuance that might walk in. And we know that those can be pretty vast and varied. So I'm going to continue to watch this particular language because I don't quite have a good comprehensive understanding of what that will look like on the ground for those of us in private practice, and what we need to be prepared for. So we'll try to give you updated information as that comes forward. One other piece of information, we do try to update you on some of the things that are happening on a state-by-state basis, because we know that those directly impact many of our viewers. For those dentists that are in Pennsylvania, legislation did just pass that you do not have to take virtual credit cards, even though many insurance companies are trying to force providers to use virtual credit cards as a form of payment. And we know the issue with providers having to take that virtual credit card is they then have to take an additional 3% or pay these fees to be able to process the payment. That's on top of their already discounted rate. So it's one thing after another. And if the patient paid their portion with a credit card too, that's another 3%. So all of these little percentages start to add up. So Pennsylvania is looking out for their dentists and for their medical providers and did pass legislation to say that you do have an option to opt out of virtual credit card programs. Illinois also passed additional legislation recently, opening up some additional coverage in the medical space for patients that show up with significant jaw injuries by accident or disease. So cancers, traumatic brain injuries, car accidents, et cetera, to open up medical benefit for those patients who might need dental alveolar surgeries, implants, extractions, full mouth reconstructions, et cetera, to open up that benefit for them and pull it out of the dental benefit. So, we'll continue to see how these things shape out. But just so you know, that is now Pennsylvania, Illinois, Arizona, Florida, Indiana, Iowa, Louisiana, Maryland, Missouri, Ohio, Rhode Island, Tennessee, and Virginia, all recently passing dental specific benefit legislation. So it's a hot topic. We know that quite a few states are going to have medical loss ratios and dental loss ratios on their ballot for the fall. So we'll get that full rundown and full list for our listeners as well, so they can stay engaged and know, is this the right way we want to vote for this or not? And the ADA has their house coming up soon, and we always hear of a few new things coming out of that as well, and their stance and strategic plans moving forward for 2025. And with that, that's the news.